When you look into Medicare coverage, you may be wondering, what is a Medicare Supplement plan and why do I need one? So today I'm going to explain to you exactly what Medicare Supplement plans cover and why it's really important to have one. So stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today I'm going to talk to you about Medicare supplements, also known as MediGap plans. We're going to talk about exactly what they cover, as well as why you might need one and how to choose the best one. Before we get started, if you find the information in this video helpful, I'd appreciate it if you give it a thumbs up and subscribe and leave a comment down below, and we can get right into it. So when you start to do your research into Medicare, you realize that Medicare Part A and Part B don't cover everything in terms of both hospital and outpatient expenses. And that's where Medicare supplements, also known as MediGap plans, come into play. So when you first look into Medicare supplement plans, you might be faced with this big chart with a ton of plans, different letters of the alphabet, different coverage amounts. It's kind of confusing. But first, it's important to know why we need these plans. What gaps are there in the coverage from Part A and Part B that we're responsible for where we would use these plans? First, we'll talk about Medicare Part A. So Medicare Part A is your hospital coverage. So if you are admitted as an inpatient in the hospital, this falls under your Medicare Part A coverage. So it's easy to remember, Medicare Part A is your hospital coverage. So how does Medicare A payment work? Premium for most people is $0. So if you've worked for the past 10 years or 40 quarters, you pay nothing for your Part A. That's awesome. That's what we think. Medicare, we want it to be low to no cost. But on the flip side, Medicare Part A carries a deductible. So if you're hospitalized, you have a deductible of $1,408. And this is not an annual deductible. You pay it once and you're done. This is a deductible per benefit period. So it's really important to realize that if you're hospitalized more than once in a year with more than 60 days between, you will pay this deductible more than one time. And I've got a video that explains it a little bit more in depth, and I'm going to link it down below. That's our Medicare Part A. What about Medicare Part B? That's our outpatient coverage. So we've left the hospital. These are doctor visits, labs, everything on that side is Medicare Part B. And unlike Medicare Part A, Medicare Part B does carry a monthly premium. So the base Medicare Part B monthly premium is $144.60. So if you're enrolled in Part B, you're going to pay this every month. And again, that's for your outpatient and everything out of the hospital coverage. Part B also has a deductible, and it's $198. But luckily, this one is for the year. So you pay that $198 in January, and your deductible is met for the rest of the year. So that's a little bit better than that per benefit period that goes with Part A. But Part B is an 80-20 scale. So Medicare pays for 80% of charges under Medicare Part B, but that leaves you responsible for 20% of the charges. So 80-20, Medicare pays 80, you pay 20. That's important to realize because 20% may not sound like a ton, but over time, over a full year, if you've had a really bad year with maybe some outpatient coverage, outpatient surgeries, lab work, anything like that, 20% can start to add up. So our Medicare out of pocket, we've got 20% of all of our outpatient services under that Part B. Our Part A deductible, that $1,408 if we're hospitalized, and again, that's per benefit period. Our Part B deductible, that $198, that one's annual. Part B copayments, so if you go to the doctor, you can have copays, specialist copays, and Part B excess charges. So if your doctor does not accept Medicare assignment, you could be responsible for an additional 15% of your doctor's bill. So right there, that out of pocket can really start to add up. If we've got a year where we are completely healthy and nothing happens, you may not have anything out of pocket. But that's not always the case, especially when we get into retirement. We can have a lot adding up. And if we're not actively working, most people don't have all this money just kind of sitting around and don't really want to spend it on medical expenses. So what's our option? Medicare supplement plans, the big scary chart comes back into play. but it's really not that big. And honestly, although there's a lot of plans on here, it really narrows down to 2 plans. Plan G and Plan N, those are really going to be the front runners when it comes to a Medicare supplement plan. And as you can see on the side, these plans are picking up those gaps in coverage. So both these plans are picking up that Part A deductible. Both these plans are picking up hospice care, outpatient, things like that. You still have the Part B deductible. As of 2020, anyone turning 65 in 2020 or later is responsible for that Part B deductible, the $198. But compared to that Part A deductible, that's really not too big a deal. And compared to maybe the deductible on your group insurance, $198, not insane. Your Plan G will cover copays and excess charges. Plan N, possible some copays, possible excess charges, not always there. But covering, again, these big gaps in coverage. MediGap covers the gap left by Part A and Part B. Again, these plans are your way of not ending up with a ton of out-of-pocket and a ton of medical bills kind of flooding you if you have to, say, be hospitalized or have some outpatient procedures. So really great plans to enroll in, especially right when you get into Medicare. That's what I do. I assist people in enrolling in supplement plans and thoroughly explain to you exactly how they work. So if you have any questions, you can call me directly. My number is 833-65-JAMIE. You can send me an email, jamie@medicarebyjamie.com, or you can visit my website, medicarebyjamie.com, where you can request a free Medicare supplement plan quote. If we work together, there is no cost to you. Everything is free to you. And I will walk you through exactly which plan I would choose if I was in your situation. Thanks so much for watching, and if you stay tuned, I'm going to give you a tour of my website and show you exactly how to request that free Medicare supplement plan quote, and we can get in touch and get you rolling. Thanks for watching. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the home page, and the first thing you can see is you can request a Medicare supplement plan quote. And that's what I do. I assist people in finding the best Medicare supplement plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.